Hi, I'm Dr. Gunnerson with TMJ Sleep Therapy Center of Utah, and welcome to our podcast. I am here with Kacey and Sara and Mindy, here doing a roundtable discussion today on TMJ and what it's like and what it's been for a new employee to come into the office and what they've experienced, and kind of some past history of what it's been for anyone who has been in the regular dental field and then all of a sudden come into the TMJ world, kind of what that aspect is. So, Kacey, what has it been like for you? It's been a few weeks since you've been here. How's it been with your perspective?
Thank you, Dr. Gunnerson. It's been very interesting because I've participated with the practice here and there with dental, but hopping into the TMD side, it's been really interesting to see how much sleep and pain affect our day-to-day living, especially when it comes to migraines and such like that. Dr. Gunnerson, I believe we do something called an SPG.
We do an SPG. It's called, SPG stands for the sphenopalatine ganglion. And this ganglion is located in just behind your nose in the brain area. It's one of the parasympathetic ganglion in the body. And what it does is it regulates the pain. And a lot of times, for a lot of people, migraines and headaches, it becomes such a cyclical thing where they're having them all the time and there's no real cause for it. It just gets caught in a loop in that ganglion. So what we do is we go in and we anesthetize that area. And when we do that, the migraines stop and the headaches stop.
So is that more of like another Band-Aid, like Tylenol, something that you'd have to incorporate all the time daily into your routine?
Well, it can be if there's another cause causing that. And we definitely need to find the why. Why are you having migraines? Why did you start having migraines? Making sure that we're not just masking something that's more important for you to get taken care of. From Sara's standpoint, we've done a sphenopalatine ganglion on Sara injection, and she has been migraine-free since we did that. So
Yeah.
what has your experience been?
Well, coming into the TMJ world from a dental perspective is a little bit different. I had migraines my whole life since I was 5 years old, and I've been to multiple doctors, multiple treatments, multiple prescriptions. Nothing really solved the problem, and I found out from Dr. Gunnerson going through an exam that I had jaw problems and did not realize that until I was really old, and no one ever told me about that in all the doctor's visits I'd been to. And the first treatment I went through was the SPG injection to help with the migraines. It was pretty amazing to wake up in the morning and be pain-free, and I didn't really know how to act. So I called my mom, and I'm like, I don't know what to do. I don't have a headache this morning. And then I just kind of sat in bed and enjoyed my morning because I didn't have a headache or have any pain when I woke up. It was pretty amazing.
Yeah, that's awesome. And one of the things that we hope is medications have positives and negatives. And so when people are on medications for migraines, you're really trying to balance the positive to the negative. You know, is it better for the person to be on this medication? Does it outweigh all the negative consequences of being on the medications? And when we can get you pain-free, it's nice to get you off those medications because then you don't even worry about the cons that have to do with all the medications. And I mean, I love watching medication commercials where they list the thousands of things that it could actually do to you. And by the time you've seen the happy smiling faces and then you hear all that, it's like, okay, I don't want to go on that.
Right.
But that seems to be how it is.
Well, and I think along with the SPG, I went through the jaw therapy and went through myofunctional therapy with Mindy, and it all related together to make it to where I'm pretty much pain-free at this point. I'll have a sinus migraine once in a while because I have really bad allergies, but other than that, Mindy and Doctor have helped me so much, and Mindy can tell us a little bit about what she does with the breathing to help with tongue posture, tell us how to breathe correctly, because I didn't know I wasn't breathing properly. So
Right. Breathing through the mouth is actually one of the most unhealthy ways to breathe and can contribute to those migraines through that over-breathing process, the inflammation that's happening in the throat because you're being exposed to that dry, cold, dirty air. And that inflammation then contributes to the sinus pressures and congestion that's going on. It increases allergies. It increases the risk of more often getting sick in those upper respiratory areas of your body. And then that pressure that comes from those illnesses can then contribute to the headaches or the tension in the jaw, the clenching and the grinding as you're trying to breathe. And so learning to breathe correctly helps to lessen the symptoms as well.
I think from my perspective of what I do here in the office, when patients don't understand why we include myofunctional therapy in treating the jaw and treating airway orthodontics and things like that, it's really important for them to understand that breathing properly is important for everything, for every facet of your life. I mean, it helps with the jaw therapy so much when you're
Right. I
breathing
mean,
correctly.
it's the body's response or the body's need. Breathing is one of the most important things, and it will do anything it can to get oxygen and breathing. Whether it's breathing through your mouth or breathing through your nose or whatever you're doing, it will find a way to get a breath in. So proper breathing through your nose really, really, really helps in so many different ways.
And if you're waking up with a morning headache, most likely it's because of disordered breathing that you've been having while you've been sleeping that night.
Yeah. Which leads to clenching, which leads to the headache.
Which also leads to TMJ issues.
Right.
Which is a vicious cycle.
Which is a vicious cycle that we don't want you to get caught up in. So it's nice to take care of things early. And that's why Mindy spends so much time with kids in getting kids to breathe better. That's her main target is if we can stop things in the children and get them breathing correctly and get their tongue in the right position, get all that airway open the way it's supposed to be, they're not going to end up with all of these problems as adults.
Right. It sets them up for success. But that doesn't mean we can't treat adults.
No.
I mean, we can definitely work with teenagers and adults. But with children, we can be most effective so that we don't have those patterns and symptoms and bad habits that have formed over years. It takes longer to break those when you're older.
So Mindy, earlier when we were talking just a little bit about our topic that we were talking about today, what has it meant for you? I mean, coming from hygiene school and a hygiene perspective to learn the things that have to do with TMJ and myotherapy.
You know, it really has been eye-opening to me to become involved in the myofunctional therapy side of things from the hygiene perspective and things that we had been taught in school. For one example would have been what we would call toothbrush abrasion, or the recession that causes in the gums that's caused by the toothbrush, when a lot of times it's from the clenching, and the clenching is oftentimes attributed to the breathing. And so that was really eye-opening to me as I was learning those things, because it's not something that's taught in traditional hygiene school. I know that there are some hygiene schools that are starting to now incorporate myofunctional therapy, because tongue posture is then really important for facial development, which improper facial development and narrowing of those arches can contribute to poor breathing, which then leads to the conditions that we've been talking to here. And so if we can correct these while the child is in a growth phase and prevent that narrowing of the jaw, then we set them up for successful breathing and less pain in life associated with improper facial development based off of tongue posture.
Even the and tongue posture breathing, even the amount of caries, decay that a child gets can be a lot of times go right back to this child's a mouth breather, because we see brothers and sisters and they all brush and take care of their teeth, and one gets cavities and the other one never gets cavities, and they eat the same food, the same treats, the same, they come from the yeah. So it's interesting to see that when you find out that they're a mouth breather, that's why they're getting the cavities and the decay and the caries. And in order to fix that, really sets them up, like she was saying, is the less we have to cut into teeth and remove tooth and replace it with plastic, composite materials, the better off you're going to be the rest of your life.
Well, I think one thing that's important too that's becoming more prevalent to parents is airway orthodontics. We don't just want our kids' teeth to be straight. We need them to have the proper airway. And I think that's a big thing that we should probably discuss, the importance of doing the airway orthodontics correctly instead of just for cosmetic reasons.
Right. A lot of it used to be that orthodontics would go, it was made for functional reasons, just for the fact that a child couldn't chew, their teeth in the line. And so it was really set up for functional reasons. But then we got into the aesthetics in the 80s and the 90s and the 2000s. It was all about how fast can I get my teeth straight and get it done, quickly. And so they kind of dropped the airway aspect of it and didn't really look at it. And now we're looking at people who were in the 80s who had teeth extracted in order to make rooms to straighten their teeth. Like me in that situation, now have sleep apnea, and that leads to sleep apnea. And so now we're seeing that that wave come through of everybody who has now sleep apnea. 67% of the population snores. 50% of the population has a sleep disorder breathing. And those numbers are just going up.
If you've had teeth extracted and then the jaw or the teeth have been compressed then now to this smaller sphere because you don't have as many teeth taking up the space, that's really limited the space of where your tongue can be. And so your tongue has to go somewhere, oftentimes falling into the back of the throat. So if you, in your history, have had teeth extracted, permanent teeth extracted, and orthodontics to close up that space and straighten things up, you probably ought to consider getting a sleep test.
Yeah, absolutely. Well, I want to thank you guys. There was a great discussion on seeing a perspective from Mindy's standpoint, from being a hygienist, and Sara from working in the dental field to all of a sudden going into the TMJ field. What that unique eye-opening experience has been, and for Kacey, who has just come in to assist me in what I do. It's eye-opening. It is definitely eye-opening. It was eye-opening for me when I first learned about it, and so keep joining us on our podcast and following us, and we'll continue on more discussions about TMJ therapy and new techniques and things that we're finding.